I'm going to test our feed. Testing. I'm going to test our feed. Okay. We're good there. I don't have any IT people with me today, Cassandra. So, and look, as a female, and I'm sure you appreciate, sometimes we women have to play two, 3 or 4 different roles. So today I'm host and IT person and all of those kind of things. Rod, if you're listening, I miss you so very, very much. And I appreciate you. So I have to say that. Rod is just amazing. He's been working with Women for Progress whenever we need him on the other side of the camera. So
yeah. And I am not useful at all on the IT side. I had an issue with my printer and ended up calling our IT person. And he said, "You just didn't turn it on." I was like, "Oh, okay."
Wow. Well, thank you so much for joining me. I want to just let our audience know that you've tuned in to the virtual edition of the Working Woman Report, which is programming brought to you by the Women for Progress Radio Network. And the Working Woman Report is programming to, of course, there we go. Okay, that's Working Woman stuff there. Let me get back live again. Okay, sorry about that. Call came in. But with the Working Woman Report is programming to highlight the work of women throughout the state of Mississippi. And we meet here every Wednesday from 12 to 1, and we talk to women from various industries and various walks of life from all over the state of Mississippi. And I'm so glad and very appropriate for us today to be talking with Miss Cassandra Welchlin. And before I get into our conversation and reintroduce her to you, I want to say to you again that if you'd like to reach out to Women for Progress, women, if you need anything, if you have a question that you can't get answered, you need access to resources or opportunities, please reach out to Women for Progress at mail@womenforprogress.net, mail, M-A-I-L, at womenforprogress.net, or give us a call at 601-259-6770. We are extremely responsive. Even if you just need someone to talk to, we have an amazing chaplain staff that will sit with you, talk with you, pray with you, cry with you, weep with you, whatever your needs are. So I want to remind you that within Women for Progress, you have a friend. We have a membership of over 200 dynamic women that are just waiting for you to put your hand out, put your hand on our shoulders, and to be able to help and support you. So please do not hesitate. This is not a time for you to be shy, have shame in your game about anything. We're all going through this thing, and we all will come out of it together. But this is the time for us to lean on each other very, very hard, and do not hesitate to reach out when you need help. And we all need help in various ways. Some of us, we had it going on before this thing happened, and we're going to get through it wonderful. But some of us need help. All of us. So make sure, whether you have a question about your children, you need help with working with them at home, you need help with your business, you need to know the step forward with all the opportunities that are available for you to empower yourself and your business and your families, whatever it is. We do not have all the answers, but we guarantee you we'll help you find those answers. So make sure you reach out to us and keep connected on all of our social media. We're going to continue to share information with you, resources with you, and information that hope will continue to empower you and your businesses and your families and our community as a whole. Now, I want to introduce an actual member of Women for Progress, Miss Cassandra Welchlin. I'm glad to be talking with her today. Cassandra Welchlin has never been afraid to challenge the status quo. Her mission to fight for the rights of women and girls has shown that she is dedicated, committed, and willing to do what is necessary to create change. She has organized women's rights organizations, fought for families to have access to child care, and she has stood at the forefront of the movement to make Mississippi a progressive state. She is co-convener and lead organizer of Mississippi Black Women's Roundtable, an intergenerational statewide network dedicated to increasing civic engagement and voter participation among Black women, while at the forefront of championing just and equitable public policy on behalf of Black women and girls. And she is the co-founder of Mississippi Women's Economic Security Initiative. Welcome again, Cassandra, to the Working Woman Report.
Thank you for having us, and what a timely day to have this this being aired on, given where we are in this state and in this country. So, very timely conversation.
And one of the things to say something positive about even our conversation today, and even this topic, is that this pandemic has spotlighted the value of the work of women to not only the Mississippi economy, but to the U.S. economy. And and we as women, both you, I, and so many of us, all of us, and especially women in our walks of life every day, every conversation that we have, we need to be spotlighting and giving women a pat on the back. We need to talk about connecting the dots to the work that we do as women and how it impacts our economy. We here at Dependable Sources Workforce Center, we're training individuals for the trucking industry. And the amount of women I talk to every day and the ones that I communicate by social media every day, women are even out there on the front line as truck drivers, moving America and making sure that we continue to stay alive, have a quality of life. And so I am just excited about the power that women have stood up. I saw a post on the Black Women's Roundtable post this morning when I was looking at your social media page, and it says that women always have to do what is necessary. And we always, it's not a choice for us. We have to get up and do and take care of our families, our businesses, our loved ones, and our communities in our state. So I'm glad to have this conversation with you this morning. Now, you are working a lot with women every day and to empower them on a policy-making realm. And during this whole process, Cassandra, we have now focused, of course, on our personal and individual lives, but we cannot take our eye off the prize from a policy standpoint, because everything that's happening right now is around, do we have good leadership? Do we have the policies in place to empower women and families? And also, the other big issue is when we talk about policy, even new policy that may come out of this particular crisis. So talk to us about that in your work that you've been dealing with over the last few weeks.
Yeah, so it definitely, COVID-19 has definitely raised the visibility of a lot of these issues that you just talked about, and how women are really they become the face of the crises. And we can get a little bit more into what that really looks like. But they are the face of this crisis. And there's been a lot just in the last 2 days of who is really being impacted health-wise, when it comes to, who's being, who's contracting COVID. And it has been African Americans. And then also it's been women who are contracting COVID-19. And so what does that really mean for our communities, given that women are at the forefront and are the essential workers. They are the essential workers of our communities, of our country, of our state, of our cities. And so we can't ignore that. So some of the things that we've been really elevating over the last couple of weeks one, just trying to meet the immediate needs, of these women, of these moms, and so many of them are low-wage workers, and they also are single moms. And we know that, in the state of Mississippi, single moms, head their households, and the stats are pretty high of what that looks like in our state. And also, they're the breadwinners and the co-breadwinners of their families. And so we just want to be able to meet their needs, as so many are being laid off, but then yet we have so many too that are, the cashiers, that we'll get into a little of that too, like who are they? And so we've been trying to meet the immediate needs of them, the childcare workers, as well. And so we've been meeting the needs, but then also wanting to provide them with information, particularly these small businesses, such as childcare centers, such as hair salons, how to get access to the dollars that's coming down from the federal government. And I find it's very interesting when there is a crisis, and our country has a history of this. When there's a crisis and it impacts everybody, the federal government begins to implement a policy that will try to get resources down. But of course, we have to look at, well, who's actually getting access to that? And I think the U.S. Congress, the Democrats, really did work really well to try to come together to say, we're not just going to pass a corporate bill, but we're going to pass a bill that try to get some money into the hands of these families that's being impacted. So we look at the war on poverty programs. The same thing happened. They passed federal law to create a mechanism to get money into the hands of those that's being impacted. So if they can do that, we know policy does that. Mm-hmm. And so that's why this is really important. Policy impacts our kitchen tables. I've said it over and over and over again. Policies impact our kitchen table. So we must pay attention, and then we must continue to advocate for some demands on this. So we've been looking at making sure that this stimulus package is representative and can get into the hands of the child care centers, of the mom and pop stores, but also the stimulus money, the unemployment insurance. So we've been doing a lot of advocacy work at the federal level, making sure we're putting comments in to those to those letters, sign-on letters, and just doing a lot of education on that. So we've been making sure that happens, and then hosting webinars and co-signing on webinars so that our folk can really understand how can they apply for the money, when is it coming down, but then also elevating the stories of how women are faring, and so all that stuff is so important. As we elevate the issues and just really telling the real story, because when this is all said and done and we don't know what it's going to look like, one thing we can be sure of is that we're going to have some families that are going to be economically impacted significantly negatively, and so that's some of the work that we've been doing and elevating.
Well, I want to start by hitting a few points right off the top that are big for us to highlight. Is our executive producer of Women for Progress Radio always says to me, Willie, we have to continually to connect the dots. And so when we talk about policy, I know that even before this pandemic happened, yes, there's some of us that are part of the choir that we understand how policy impacts us. So when we go to the polls, we know that we are not only voting for that particular representative, but we're also we're voting for people who we think will make good policy that will impact everybody and be hopefully good and fair to everybody. So this is a time for us when we so much is involved around the monies that are going to come down from the government. As you stated, policies that they're talking about putting into place to not only administer these funds, but also some policies that are going to impact us on a longer term pace beyond this. that we as women specifically need to understand how policy impacts us, and it's all about the policy. And that when we come through this thing and we get back to these tables, we need to understand that we need to be at these tables. We need to be in leadership at this table. We need women like you in leadership roles, political and public roles that are able to fight for us. We need to make sure we support more women in leadership roles so that those women are at the table to impact policy, not only just to be part of it or we vote for it, but we need to be designing policy that's going to impact us and families. So I want to make sure that we highlight that. And folks need to understand how it's all, a lot of people say it's all about politics. It's all about the policies, okay?
No,
the other thing I want to highlight during the conversation you're talking about is the women, identifying those women who are on the front lines. When we walk into our Dollar General stores, when we walk into our Walmarts, that's who's there. I read an article that you did in the Clarion Ledger, and I hope Mississippi Today, and people need to go and listen to read that article. It's a very good article about what's happening with women and women on the front lines. But when we talk about, there was one person who shared her story and say, look, I want to go home. I want to be home and to be safe and secure with my family. She said, but I have to work. She said, also, I've worked at long and hard at this job. I've gotten to a certain level in this particular position. And my fear is if I go home, I'm going to lose that. And so a lot of times women, we want to be home. We want to be home with our families. We want to be in those safe environments. But many women don't have that choice. They said, I got to stick in here. I got to be here. And I got to do what I have to do because it's not just about the next couple of months for me. It's about long term. And women don't have those choices all the time. And then we talk about our healthcare workers, our CNAs that are, when you talk about front line, you don't get any more front line than that, because we know a lot of our seniors are contracting this virus. Even though some of them may have gloves and masks, but sometimes that is not enough protection for them. And there are in intimate environments in their hospitals, in the clinics. I had a call from my own doctor office and said, you have an appointment on this particular day, but we advise you to stay home unless it's an emergency, because we got people coming in here that might have the virus or might be carriers of the virus. And so we suggest you stay at home. But what about the people, the nurses, the CNAs, all of those assistants that are working within that clinic? Yes, I could stay home, but many of them cannot. And then a lot of us who are in essential jobs, we have children. So we have to have care workers, daycare workers, to be able to care for our children while we're at work. Many of us don't have the luxury or leaving them with family members, etc. So women are for real on the front lines every single day, nonstop, since this situation has begun.
And if I can just paint the picture for us, so half the workforce in Mississippi are women. And they're 2/3 of the minimum wage earners. And I always kind of open my conversations with that, because to me that's important to say, and I want to keep saying it.
Repeat that again. Repeat that 2/3 figure again, Cassandra.
Yeah, half the workforce in Mississippi are women, and 2/3 of them are minimum wage earners. And again, so we're talking about minimum wage. Minimum wage in Mississippi is $7.25. And when you're talking about a lot of these women who are, the CNAs or working at the Dollar Generals, or even the Walmarts, they're not making more than, $9 or $10 an hour. That's not enough for, a single mom and her children, right? It's just not enough.
Right.
And so I just wanted to paint that picture, just for a minute. I think one of the news stations a couple of weeks ago did a story on the garbage truck workers. And one of those, on the driver of that truck was a woman. She said, I actually love my job. Last night on Nightline, they did another story on the garbage waste management workers. Right, they are waste management professionals, and it gets into a little of what you do with truck driving.
Yeah.
And she said, yes, I would love to be at home. She said, but at the same time, who's going to do that job? Because we got to do that job. But I am on the front line of this, and so it's a tiring job. Last night, the woman talked about I have a child, right, and. So I have to, have the child care taken care of. So I just wanted to just paint that picture and also say, that Mississippi has, one of the widest, not only wage gap, the highest poverty rate, as well, in this country. And so they're at the front lines. And so we have to be able to recognize that and begin to give these women a platform to really say, they are the ones that's really taking care of our communities, making things work for our neighborhoods, for our households, for our cities, right? And so it's so important, just really important. In our report that we released in September, Women Driving Change, one of the interesting during our research, we learned that 91% of the healthcare workers are women, and 62% of them are Black women, and these are healthcare support staff. And so they are absolutely, on the front line of this pandemic. And so we hear that they don't have, again, the PPEs that they need. They don't, and that's also with some of the child care centers too. They have been asked to stay open, but they're not given all of the equipment that they need either to, help provide that kind of support to these frontline workers. And so it's just so important. I was at the grocery store one day last week just trying to get the last minute things. I ended up going to 5 grocery stores because I couldn't find any toilet paper. Just like everybody else, I was out. I had 2 rolls, and it's 5 of us in the house. And we use tissue we use tissue.
Yeah.
And I went to one of the stores, and there was a woman who was sweeping the floor, and one of the, sweeping the floor. And she was mumbling under her breath, and the mumbling was a little elevated, and so I could tell that she was frustrated. And so I said, so she was just saying, I've been on my feet all day, I'm just tired, and she was just fussing.
Wow.
And so finally I said to her, and she was probably about maybe 5 or 6 months pregnant. So finally I said, how long have you been working? She said, I've been here all morning, and it was 6 o'clock.
Wow.
And she said, I've been on my feet are hurting, my back is hurting, and I'm tired. So then I said to her, do you not have pregnancy accommodations? And she was like, no, what? No. And I said, so you're not given another, have you not been assigned a different, different work responsibilities? She was like, no. I said, you have rights, and so we want her to have a healthy baby, and we want her to be healthy. And given this is also, Black Maternal Health Week as well, I think about her, and I think about all these other pregnant workers who are out there. They have to bring home a paycheck. They have to work because, as you said, they're afraid of losing their jobs. And so we have to hold accountable these, employers to abide by, some of these national policies that's coming down, but also at the state level and local level, we have to do our part in educating these employers and building coalitions to hold them accountable for how they treat the workers as well.
And again,
so
I have to say,
my number, it's like, call me, you have rights. Let's talk about that and put her in touch with some other partners.
Yeah, and I think too, in not saying that we're doing a gotcha to businesses, But a lot of businesses have not been educated on these options, and lots of times it makes even improves your staff, your workforce, when you are accommodating or can accommodate certain things, because there's all types of work that has to be done in order for us to do our businesses. But it also comes back to real leadership. When we talk about even our leadership on a local level, and on a federal level too, but even on a local level, what's important, if we have someone in the governor's office that are making these types of policies priority, when we talk about equal pay, when we're talking about Medicaid expansion, access to affordable health care, we have to have leadership that understands, and I say again, that can connect the dots to these policies. And look, this is not an individual thing. This is not a black or white thing. This is not a rich or poor thing. All of this impacts our economy as a whole. It impacts how I do business. It impacts my community. It impacts my state. So these are issues that don't belong to one particular entity. It's about all of us. So I hope that we begin to begin to think about that and really put these things in perspective. But I want to highlight a few things that few numbers that you gave again. 90% of healthcare workers are women. Is that correct?
Yeah, 91%. Yep, are healthcare workers.
And 62
are women, and 62% of them
are black women. That's some real numbers. Because let me tell you, I once had a healthcare business, and I know what healthcare workers make on many levels. When they're CNA workers and nursing assistants, it's not a lot of money there. So when you say that 90% of women are in healthcare industries, you can imagine, and let's connect the dots a little further. We talk about these women and their wages, but these women also, and what happens to them impacts their families. So now we're talking about something that impacts much more than just that individual. Yes, that woman and her wages, but what she can do for her children and her family and her household and her community is impacted by that. Correct. So when we talk about wages and making sure that women are made whole or economically secure, it is beneficial for all of us to be able to make sure that we empower women. So I want to talk about the needs of women during this crisis. Cassandra, what are you hearing from women? What can we do as a community? What do we need to be doing as community, as an organization, to help support and empower women during this process? You have talked about, of course, having information sessions to make sure that we get information out there to women and to families so that they understand the opportunities and the plans and all the different packages that are out there. But what else can we do during this time period to help support women?
Well, one, I think it's so important. I definitely, if we can, and I think communities are really pulling together, at the local level, all across the state, trying to just get food to households, right? Setting up emergency food or rapid response funds to make sure that folks have. We've heard a lot about, a lot of single moms needing Pampers and, baby food and wipes and all of, those basic necessities. Mm-hmm. And I think people are really pulling together to do that. Mm-hmm. But I think it's so critically important, though, as our state leaders are working to try to slow this pandemic down, is to make sure that we are demanding that the data is transparent. That's so important because that data is going to drive what the advocacy efforts look like, but also what the outcomes will be in our community. So, for instance, we know that African Americans are being impacted at a higher level. So what does that mean? That means more testing really needs to happen in African American communities, right? Mm-hmm. And in many ways, I think there has to be also a demand on who gets tested based on what the symptoms are, because now that more and more data is coming out, the symptoms are not just the fever and not just the cough and some of those other things. We have some, and my doctor, she's a researcher, and she said what she's finding is that you have more and more women, more and more people are having gastrointestinal issues, right? And so that's also, a symptom. So we can't just limit it to, those symptoms and just to a certain population. If the data is showing more and more African Americans are sick and are testing positive and are dying, that's where we've got to focus our resources. So I think as a community, we have to say to our State Department and our governor and put a demand on that we want more testing in our community, and that we want to be treated, and that we have to have them get all of the equipment necessary. So I think that is so important, going forward. Those are some things as an advocacy community that we have to do.
Well, Cassandra, who do we need to write to? How do we engage and send that information, those requests? How do we reach out to our leadership, our governors, our representatives, to make sure that that pipeline of requests, that, like you said, highlighting stories, that we're sharing that with our leadership?
Yeah. So one of the things that we are going to be working on with several partners is to put together, a letter where we are, and they can have partners sign on to that letter, and we will send that letter to, the health department saying these are the things that we want. I also know that the NAACP and some other organizations are having conversations with, the State Department of Health, trying to get some of that data. But as an organization, as partners, we're going to be, getting a sign-on letter, and folks can sign on to that so that we can get this over to them and let them know that we're watching. Even in this moment, we have to be vigilant. I went through Katrina, and there was a lot of lessons learned, through Katrina. And one of those things were if our people, particularly our black leaders and our black community, if we're not watching, they're not watching out for us. And so that is the truth of the matter. And so we have to be vigilant, and we have to put a demand on the power to make it be responsive to our needs and our communities. Katrina taught us that, and so we have to be vigilant even more. It's interesting. It's like, as you said, we got to also help families connect the dots. This Family First Act that came down, the CARES Act that came down, that's a policy, a law that was made so that you can get more resources to your kitchen table. That just didn't happen just because it was a thought. That was actually legislation that had to be written and voted on. Now you're able to get, an insurance that's $500, $600 more than what the state level uninsurance is, right? So policies are so important, and we have to educate our people about it, make sure they have the TA around it so they can access that information. But we must hold our elected officials accountable. I would say even more, have our people contact their legislators to say, we want more testing, so we can, have them also make the request as well for our community. And we know rural communities are really not getting what they need. We hear it all the time from our partners, up in the Mississippi Delta and in Southwest Mississippi. They're not getting the testing and the information that they need. And so we have to be able to do more testing so that our people can get what they need.
And I want to shift to the little bit more of the politics side of this thing. And I want to say too, this is an important time for us as women too, to let our voices be heard, because when we because of everything that's going on in the media, and we're seeing that women are on the front lines, and people now have an understanding of women's work that they have not had before. there's been a spotlight on the work of women like it has never been before. So this is a time for we as women to make sure that we take this as an opportunity to let our voices be heard. And we and I tell you, we won't have to shout as loud as we have been, even though we need to continue to do that, because we know the ears are now open that's going to hear from us, and they know how our work impacts them. But I want to shift a little bit to the politics of it, because I want to say to women, these are the times that we need to understand when we need real women in leadership roles. So when we get back to the polls, when we get back to our elections, I want people to understand, not only women, but men that out there, everybody out there, that we need to really look at women on the ballot. When we have, and even before she gets to the final ballot and we get to the poll, we need our communities to support women. Women need money in their campaigns to run. Many women who are qualified and would make great leaders do not throw their hats in the ring because of the financial challenges it is. This will take us a lot more money for women to be able to engage, because a lot of times they have to spend a lot more extra money than the average person that is running. So we need to support women. Women for Progress, we have a PAC that has been launched that we're going to be supporting and raising money and supporting women for public service. So when we reach out to you and ask you for help, we want you to hear us. And we want you to think about these times and the importance of having women in real leadership roles. So I wanted to take a moment for that. But I want to shift because we got an important election that's coming up. And I was just listening on the news where Wisconsin has went ahead and did their primary when they know that these are sensitive times and the average population cannot get out, especially those who look like you and me, because we got everything going on. And even though it was recommended that they put a hold on this thing, like a lot of the other states are pushing back their primaries, Wisconsin had decided to move forward. That means that a lot of people who normally would have had their voices heard by their vote may not get the opportunity to do that because many of us are shut in. And so these are the kind of things when we are talking about access to voting and the impact of voting. And they specifically said in the news this morning that communities of color and women would not be appropriately represented in this particular primary that they went ahead and did. So we know that there's a lot of forces out there that are intentionally making sure that certain people don't get to the polls so they can get outcomes that they want. We have issues that are on the table that we need to have conversations about, but this COVID-19 has been on the forefront, and there's awareness that's got to happen. So what should voters and Democrats be doing during this time period to make sure that we, of course, have access to every opportunity for voting, that our voting rights are being protected? The voting rights and our rights being protected has got to be up there in the top 5 right now.
Oh yeah, absolutely. When I saw the verdict of the courts in Wisconsin, it was mind blowing, but not surprising, because what we're talking about is, again, you want to disenfranchise folks, from getting access to their right to vote, which is, part of the history, of this country when it comes to, people of color, Black folks, women voting. I mean, it was codified in our Constitution. And so, and we had to get that amended so that folks can get the right to vote. And so what it shows even more is that we cannot do business as usual, and that we absolutely must, overturn what our election system looks like in this country. If we're going to go on with elections, and I don't think we can do it like we have been doing it. So we must, there's been folks here in Mississippi who's been fighting, to get online voting, right? We need to do those things have early voting. We cannot go back to doing business as usual. And so some of the things that we are going to be working on, with our partners is really working to, have that kind of conversation at with our state leaders around that. We know these elections are coming up. And so we're still, trying to do the education. But what we know is even with online voting, this situation has really heightened where the any equity issues lie. Some folks don't have access to broadband, so they don't have access to the internet. I had a conversation or a tweet from or a text from a teacher this morning about my baby, making sure that she was on task and she had her homework packets and all of that, because they want to make sure that if it comes down, that kids are able to pass to the next grade. And I was like, well, is that a real conversation that's being happening right now? And it was like, yeah, it's a conversation that's being had. I said, but not everyone has the same thing. Yeah. And so, and that goes to our elections, and to everything we've been talking about today. So it is so important that we have a different conversation around what voting looks like right now in this country and in Mississippi. We cannot, and I was looking at the news last night, and one of the ladies out there, she said, how are we supposed to be quarantined and we're out here voting, and we're supposed to be 6 feet apart from one another, but I'm an African American woman, right? And so, just looking at her, it's like, she is at a real, heightened situation where she can contract, COVID. And so she shouldn't be out there. None of those folks should be out there, but it was just a mechanism to disenfranchise folks. And you got folks that are sick. So how do you, people who would have been well, possibly, how do you now choose who gets to vote and who doesn't get to vote? Like, to me, those are conversations.
And also we know that our senior population is one of the largest voting blocks out there. And during this time period, the last thing that they're thinking about is going out there and voting.
So I think at some point we will, there has to be some action to really put some injunctions. Stop the courts, or stop the, some of these elections from taking place in the normal way that we've been doing. I mean, I think we're going to have to, in order to make sure, our people are counted. And that is so important. And
everything now that has shifted a lot to online access. I mean, we're having this conversation here on social media because we can't do it in person. So you would think that the voting process right now, we should be putting into policy and into place right now these lacks. Even just say for the next couple of years, we're going to put these things in place because we don't have an option. We have to find ways that people are still able to have their voices heard and they have their right to vote. So we need to make sure for that. Now, I want to touch too on the few minutes that we have left. Before all of this happened and we got into this pandemic, you, of course, was fighting for equal pay here in Mississippi. You're always focused, of course, on access to more child care opportunities for women, because we know that the cost of child care right now, it's almost a full paycheck for some people. Especially if you're talking about women who, you talked about that percentage who have minimum wage. I mean, the cost of hair, $120 is probably the average a week for child care. And if you're making $7.25 an hour, my goodness, most women are saying, I need to just stay home and try to survive instead of working out there. So all of these were policies and initiatives that you have been working on for years. And again, you're here back to the table at 2020 before the session was closed, working on these particular issues. What's the status of that? How do you plan to move forward when this thing opens back up again?
So we, the Black Women's Roundtable, the Women's Economic Security Initiative, we have been pushing, as we have been, the last couple of years, really talking about how do we support women in the workforce, how do we support single moms, and particularly Black moms and Black women workers. How do we support them, and what are some of the things? Now, we never do anything on our own. Mm-hmm. All of our work is informed by women that we hear from in community. One, I'm a social worker. Mm-hmm. And so that's just one of our principles, is that you never do anything without hearing from the people, and you're working in sync with them. And so all of the work that we're doing is informed by our constituents. And so, so what we were pushing for before the session closed is what we heard women say: they need more money. Mm. And so they needed more money. And so we worked on pushing forward a minimum wage bill. Of course, that died, but we weren't the only ones. There was a lot of us that was working on trying to get more women money, so they can pay for those needed things that we talked about. The other thing, of course, has been around equal pay. And we looked at equal pay for equal work as a way to boost women's wages. Again, we don't have a minimum wage law in place. And so that just became a platform for us to really talk about how we get women more money so they can care for their families and more income. And so we worked really hard. Again, we had some incredible legislators that would put forth our legislation for us. And our legislation died. However, Senator Sally Doty was able to, introduce her own legislation. We did not support that legislation on its face. And the reason why is because it was more burdensome than the federal law. Mm. And she didn't want to, work with the other women who had been working with us for a really long time on this equal pay bill. And it was a really good bill. Our bill had transparency language in there, retaliation language in there, and just really language around just letting businesses self-correct, so that they can, work that internally. We didn't even want all the lawsuits.
And how I like to call it is, for businesses, it did no harm.
It did no harm. Yeah. Exactly. It did no harm. But her bill became more burdensome, and it will be more burdensome to the plaintiff. And so for us, we told her we could not support that bill on its face. It ended up passing anyways, and it was going over to the House. And then that's when the session closed. And we were going to be working with the House to get some amendments in that bill. And so when the session comes back in, we will continue to do that work. We're going to be having a teletown hall on the issue, because this is not going to be an issue that's going to die. I'm not going to let it die, because again, we're talking about how do we close that wage gap so that more women can get money to take care of their families. And so we'll be having a teletown hall, and I'll be sending the information out to you all. The other legislation that we were working on was around pregnancy accommodation and also expanding Medicaid expansion 12 months postpartum. Pregnancy accommodations are so important, for the pregnant worker. And we were able to get it passed out of one committee, which was a win for us. And we have amazing partners on this with us, such as March of Dimes came on board, with us. We had Planned Parenthood that was with us on this. We had just so many wonderful partners that was working with us. The Workers' Rights Centers out of Greenville, Jerryville, like all these folks have been working with us around these issues. And we got it passed out of one of the committees, but it failed in the second committee. But we were given an opportunity to talk at that committee about why we needed a bill that protected pregnant workers. And that we counted that as a win. That was the first time, and we have been introducing this bill for the last 3 years, and we had got no traction. At least we got some traction. We count that as a win, and we'll be coming back next legislative session to elevate that issue. And then we worked with incredible partners Jarvis George, the legislator, who's been just hard at
Wonderful.
it when it comes to, expanding Medicaid and expanding Medicaid to women 12 months postpartum. That was a really important issue. And what we did, we really created this partnership and coalition among organizations and interested, community members who cared about maternal health, who cared about healthy moms, who cared about healthy babies. And I care about, the mama, the single mama, who's the worker, because she's all of that. We don't separate her, right? Mm-hmm. And so we all came together because we care about that mama. And so it was just really incredible. And so that legislation, though, didn't pass, and it died in committee. However, the session was still open on the House side. And so, there's work to be done. Right. And now even more so,
right.
It raises the issue that Mississippi needs to expand Medicaid
yes.
to all people.
Yes.
Right?
Yes.
So this situation really elevates, those kinds of issues because we want a healthy community. And particularly when you're talking about who's dying from this, it's Black folks who's dying from this. And we need access, and we need access now. And also child care. Work with Mississippi Low Income Child Care Initiative to try to get a board to bring about some accountability. Before all this happened, the scandals happened in the Department of Human Services when it came to the safety net programs, and who, was getting the money and who wasn't getting the money. We know the poor of the poor was not getting those resources the way they needed to. So those are some of the things that we have been working on. When the session goes back, we will continue to do that. But we're not going to wait on the session, right? We're going local, working with mayors and council folks, trying to do a lot of education around these issues and having them partner with us on some of these issues. So we have an Equal Pay Committed Cities campaign where we're asking cities to join us in this effort. Pass your own ordinances. Be the leader. I mean, you look at what happened with the city of Jackson just yesterday. I mean, they're going to be doing their own testing. That's incredible. Yeah. We need more cities to do that, and more cities, I believe, will stand up and do that.
And this is a good time, too, when people now are being touched where they're sitting and where they're standing. And now their mindset is different. They have a different understanding of why we need to support these efforts and be at the table for them and give our voices and create these partnerships and coalitions that when the session does open, when you go to those committee meetings, that we'll all show up in support of you and bring our organizations and our businesses and stuff to the table. I want to wrap up our conversation, Cassandra, today, that really... I think I think women need to look at these real solutions to when we talk about equal pay, when we talk about higher paying wages, and I want to talk about non-traditional jobs for women.
Absolutely.
And I think at every conversation I'm leaving nowadays that I cannot leave an opportunity to talk about the jobs out there that is available. Of course, my thing is transportation, and I talk to women. I'm really having a lot of conversations around these opportunities. I get so excited even when I start to talk about it because I have a partner. We have several partners that employer partners that we put our individuals and graduates from our school program into. But one new partner that we have with us has a program where, first of all, their first-year graduates are bringing home on a weekly basis after taxes and after any deductions around $1,500 to $800 a week, bringing it home. And then for women, what they're doing, because they want to get more women in this industry, they're paying now, offering women who come on board with them an additional $200 a week on top of their regular paycheck. That's an extra $200 a week, not a month, a week. If women are interested in getting their degrees, I mean, and I'm saying to women, look, you don't have to be a truck driver forever. There's a lot of opportunity in trucking that you can move up to. There is no glass ceiling when it comes to transportation. So they will pay for your college degree. They have an online university. They'll pay 100% of the cost of. But let's just say if you wanted to go to Belhaven online or Ole Miss online or USM online, they will contribute to that cost for you.
Wow.
And I cannot tell you about the other business, health insurance cost, vision coverage, dental. And then the exciting thing about that college program is if you don't use it for yourself, you can use it for one of your family members. If you have a child that's getting ready to go to college, that person can use it. And we know what the cost of education when it comes to 4-year degrees now. So those are just a few of the benefits, but I can go on and on and on about the opportunities that are out there available for women. But not just trucking. I mean, of course, trucking and transportation is considered a non-traditional role, but there's so many other opportunities. You want to become an electrician, a plumber, an HVAC person.
Construction worker, yeah.
Yes. I mean, there are so many opportunities out there, and there's training available. Right now, we have scholarships here at DSE Training Academy. If you are female and you want to go and you said, well, I've been looking into trucking. I know the money that it pays and the ownership opportunities available. You can come here to DSC and get a full scholarship here at DSC and go to work in 4 short weeks. So a lot of us are already off work. You've been thinking about another career. This is the place that you need to consider. If nothing else, you need to call me and let me talk to you about the opportunities that are available. It doesn't cost you a dime to do that. You're already home at work. And now what we have, Cassandra, is we have an online classroom. So for the first week of your classroom instruction, you can do your training online. And once you complete your training online, then we transition you to the yard and the road instruction. So right now, those individuals out there, whether you're male or female and you're interested in getting into trucking, we want you to reach out to DSE Training Academy. Our website is drivingyourfuturems.com. Drivingyourfuturems.com. Go to that website. You can apply there, and you can contact us there. Send us an email. We are, because of the pandemic, our administrative staff is all at home, but you can reach out to us by email and by telephone, and we're going to connect with you. You can leave a message for us. We will call you back within 24 hours. So we want you to reach out to us and let us just share with you about the many opportunities that are available. Many of you right now are in jobs that pay lower wages. You and I just talked about the minimum wage jobs and percentage of women. But even men out there that may be making $9 or $10 an hour, we want to talk to the men out there who are interested in higher paying jobs where you the first year can make $50,000 to $70,000 a year, your first year, with great benefits and opportunities. We want you to reach out to us because these are real numbers. These are real benefits, real opportunities, not a maybe. When you graduate after 4 weeks, you go to work. Many of our graduates graduate on Friday. On Monday morning, they're at their new jobs. So I can talk on and on about the many opportunities out there, but we want you to call us. Go to our website. Our telephone number here is 601-351-5858, 601-351-5858, and we'll be glad to share the information with you about the opportunities available. Because we have to empower ourselves beyond this pandemic. I was telling a friend this morning these are tough times. It's very challenging times. I think for us here at Dependable Source in DSC Training Academy, even though it's tough, it's one of the toughest times that we've ever experienced from a business standpoint. But we've been here before. We've had some challenging time over the 28 years that we've been in business. So we know what it looks like. We know what it walks like. And we know that we just have to take one step at a time. We have to stay focused on our mission and our goals. Of course, here we're looking at safety of our employees, and that's why we've sent our administrative staff home and our instructional staff. We have a small instructional staff that has remained here, and we're taking the necessary safety and precautions that are here and making sure that we take cover. And we're doing things like our online classroom that people can do their work online. So there's a lot of options and things there. But we want to say to folks, it's difficult times, and it's probably going to get a lot tougher before we get through this thing. But I want you to focus on the other side of this thing. When we get on the other side of this mountain, it's going to be incredible. We're going to all come out better as a community. We're going to come out better as families. But we have to make sure that we get up every day, do what we need to do, continue to educate our children, make sure. And I said to myself this morning, I've been running Cassandra, and I just said to myself, slow down. And I want to say to other women out there, slow down. We can't do it all. We don't have the answers to it all. Sometimes we get up every day and we think, oh, if I do all these things on the list, that's gonna get me through. But some of it's out of our control. And I tell you, you gotta stay focused on prayer. And that's something you got to do when you hit the floor. That's something you got to do at noon. That's sometimes something you got to do at break time. You have to do that. I tell you, I'm a A-type personality. I think that I can fix everything, and I've realized that we cannot. But we can do what we can do. We can get up, and that's what I said when I first started this conversation today. This is a time for us to lean on each other. Of course, you got to make sure that you're educated. Tune into conversations like this. Women for Progress, Black Women Roundtable, and Mississippi Women's Economic Security Initiative is going to be having some more telehalls and some more webinars that's going to provide information to you all and share stories of other people. So I invite you to engage. So Cassandra, could you give the website again and contact information? Also, the Black Women's Roundtable put out a great policy piece back last year called Women Driving Change. Tell how they can get a copy of that particular publication.
Yeah, they can actually go on our website and it's on there. And it's msblackwomen'sroundtable.org. It's a long website name, but msblackwomen'sroundtable.org. And the report is on there. You can please sign up for our email so that you can stay abreast of everything that we are going to be doing in the next coming weeks and days. We really want to engage with you. Like our social media page, Facebook, again, Mississippi Black Women's Roundtable, and it'll tell you how to get to our other Instagram page and social media, Twitter as well. So definitely stay connected with us. And I want to remind people to also do your census. That's important. So please don't forget to complete your census. Those dollars are more important than ever right now. We got to have you counted. Don't be afraid. Now you can do it online. It's in the mail, complete it and send it back. We cannot lose not $1 in our communities, given restaurants and businesses are closing. We need you all to please complete your census. They can reach me at C Welchlin, and that's CWELCHLIN at msbwr.org. So please reach out, and we'll be more than happy to partner with you on anything. And we want to continue to hear what's happening around, with Black women and girls.
And we'll continue to share that information too. But I want to highlight again, people need to like those pages, Mississippi Black Women's Roundtable. Go to their Facebook page and their Instagram and Twitter, and make sure you like and follow those particular pages. Follow Women for Progress. We want you to like our pages at Women for Progress. Our Facebook page is Women for Progress MS. Women for Progress MS is our Facebook page. Our website is womenforprogress.net. Our email address to contact us is mail, MAIL, at womenforprogress.net. And our telephone number where you can call or either text us is 601-259-6770. And if you're a woman and you're interested in being part of the Working Woman Report to share your work and your story, please give us a call or email, and we'll be glad to have a conversation with you. Now, next week, on the Working Woman Report, we have Miss Tanya, I think her last name had just escaped me, but we're having a woman that, when we talk about non-traditional jobs, she has one of the first African-American women who has her own electrical contracting business, and she's in Atlanta, Georgia. New York Times just had a great article on her and the work that she's doing over there. So we're going to continue that conversation around non-traditional jobs, and we want to continue to talk to women how right now you can empower yourself, get the education you need, get the information you need to take advantage of many of these non-traditional jobs that are open for women. And when we talk about hiring, paying jobs for women, you got to look at the non-traditional, what's been coded as non-traditional. I don't like to use that word. I use it because that's what people are familiar with, but I look at it as opportunities. You need to look at all of these opportunities that we normally have not been having access to, so we want to continue to have that conversation. Cassandra, I want to give you a pat on the back for all the work that you've done for years and years and years, and you continue to stay passionate. You continue to stay committed to the work. We appreciate your talent, your resources, and your skills to continue to unite us and make sure that we come together as women, as families, and communities. So I thank you so much. How are you and your family mustering during this time?
Well, thank you. It's been definitely tough. We have had, my middle girl has therapy, so we have 3 teletherapy sessions a week. And I am talking to teachers all over all the time. And so it's just been a lot to manage, but I'm thankful that they're well, they're healthy. So I couldn't ask for more. It's also been a really great time to just lean into them more. And so I've really enjoyed that a lot. I really enjoyed that.
I'm hearing that from so many women that they are excited about. I watched my daughter with her with my 2 of my grandkids, and because they're very much active and part of my life, and it's amazing to see the connection and the extra times that she's building with them, and how they are gravitating, how they're leaning into her. And so it's exciting. I'm hearing from a lot of women that they're excited about this time and this opportunity. I think the other thing, this is a whole nother conversation I won't get into, but I want to talk about also what public schools is going to look like after this, because I think it's going to be very, very different. I think you're going to have a lot of women who are now saying to themselves, look, society has told me that I need to have it all, but I'm finding out that I don't need what I thought I needed. You know, I enjoy being at home. How can I do this? How can I create my work environment to where I can be more involved with my children's day-to-day life, and even building who those little people are. And I think, our public school system and administrative I hope right now they're thinking about that, because I think when we get on the other side of this thing, parents are no longer going to say, I can't accept public school the way it is. Yes, we know public schools have challenges. We know there's monies and inefficiencies there. But I need something more for my kid. Because when now that all of us are moving to this online, many of our kids are not equipped for that, because many of the schools do not have the technology there to make sure that our kids, it's not enough for them to just take a coding class. We need our kids to be able to do it. And tapping, giving them a little bit of coding here and a little bit coding there is no longer going to work. It's not going to work. But that's a whole nother conversation. We'll have to.
One thing that my family is doing, after seeing that Nightline story last night about the waste management workers, this Friday, and I put it on Facebook, and hopefully people will join me. Whenever your next garbage run is, asking people to just go outside, have your mask on, have signs on, and just say thank you to those waste management professionals. So on Friday is my next pickup, and so our kids are going to be out there and just saying thank you, because they are essential workers. And so hashtag essential workers MS. So if folks can join in that, post pictures on that, just to let them know we appreciate them.
Wow, that's great. That's really great. And that's a great awareness piece too. And I think we need to do a lot of awareness as much as we can. So thank you so much. Well, this has been an amazing conversation, Ms. Welchlin, just like it always is. And thank you so much for your membership within Women for Progress and the work that you do in our communities. Please stay safe and stay blessed. And I look forward to our future conversations over the next few weeks.
Thank you. And you too, Willie.
Thank you.